Lung cancer is one of the most common cancers that affect us humans. 1 in 8 cancer diagnosed annually is lung cancer. More importantly, lung cancer is also quite deadly. 1 out of every 5 cancer deaths, approximately 2 million cancer deaths out of about 10 million cancers worldwide is related to lung cancer. And it is more common cause of death than colon, prostate, and breast cancer combined. What can you do to prevent lung cancer? As some of you might know, smoking and lung cancer are so intimately related. Smoking causes many cancers, but one of the commonest and heaviest correlation between smoking is with lung cancer. So if you are a smoker, quit. Today is the day. Now, if you quit, your risk actually goes down. If you are a smoker, remember this, you can still help yourself by quitting. 85% of all lung cancers are related to smoking. There are some other conditions and risk factors, including secondhand smoking, asbestosis, and other chemical exposures that can also cause lung cancers. But smoking is the number one reason for lung cancer. So, smoking induced cancers are many, and lung cancer is the number one that is associated with smoking. Second thing about lung cancer is, unfortunately, about 70 to 75% of all lung cancers are diagnosed at late stage. But now we have a very good screening for lung cancer. It is called low dose CT or LDCT. It is unfortunately underutilized compared to mammogram, colonoscopies, and PSAs. Low dose CT scan is approved in patients above the age of 50 who has been heavy smokers and has shown in multiple trials to reduce lung cancer related mortality significantly by helping to diagnose the cancer early. So briefly, if you are a smoker, do quit. Secondly, when you see the doctor next time, ask about low dose CT to see if you are a candidate. If you are a candidate, make sure you get a low dose CT because the cancer can be diagnosed at a much earlier stage where it is 70 to 80% curable than late stage. Unfortunately, most lung cancers are not symptomatic in the early stages. So that is why a screening test is important. So low dose CT for screening, and if you're a smoker, do quit. And today is the day to quit smoking. You can prevent not only lung cancer, a lot of cancers can be prevented by the simple act of quitting smoking.